The seriousness of what has occurred in the pandemic is so significant from a scientific, physiological, pathological point of view that I don't think the general public can understand just how serious the challenge we have in front of us is. It concerns me that from a clinical point of view, this information is not fully grasped by the clinical community. So, I'm going to be sharing information with you here now that is extremely important. And it's driven out of the need in the community because so many people have been reaching out to me about health issues. What can they do? And I've been focused primarily on the science because I think that it's important to understand the science before you can apply solutions. And so this is the principle of sharpening the axe. So I've spent easily about 4 years sharpening this axe. And I think that now, even though we can't have every piece of information, I think that it is about time to start piecing together some of the bits of the puzzle. And so it's caused me to design a protocol here. And for people who are interested, there's going to be a link in the description for you to apply to join this route roadmap. It's going to be very applicable to a lot of people, but not necessarily applicable to everyone. We want to review your health, optimize your plan, observe your progress, and target your long term wellness. For anybody who is been interacting with me, they will know that I do low touch in the sense that my fundamental belief is that the body heals itself. And what you have to do is understand where people's health are in order to help them to get to that wellness that they require. And with that approach, I think that there is an opportunity to try and reverse what has happened. Now, as I go through the presentation, and some people, if you're live, you'll see the full thing. If you're not, you won't because it would have disappeared. It's more interesting. It's more fun to record it with a live audience. But the principle is that if if you understand the science and you understand the implications of the science, you'll realize that I can't see how this is accidental. It is so well designed, and the implications are so far down the road that by the time a lot of people start having the issues, there is no way they would connect the two things. It's almost like poisoning someone with arsenic, a little bit in their tea every day. 6 months down the line, and they're sick and they don't see the connection. This is how big this is. It is really, really significant. Now, there's some people who are already aware that this is an issue for them. And in a sense, they are the lucky ones because they can see a direct connection. But a year and a half down the lines, a lot of people may not see this direct connection. And so, what I want you to do, if you are interested in this, is that you must look in the link below. What you will see is an application form. You have to put in your email first, and then it will take you to the application. And the reason it's designed like that is because I recognize that this is not appropriate for everyone. And critically, I have limited time and capability to try and guide people through this. But essentially, in it, you will then find the information about just questions about where you are, general answers, because this is not a medical consultation per se. And you are looking at issues, what time frame, and critically, how motivated are you? Because to address these issues, I have come to the conclusion that this is for the serious people. This is not straightforward. This is not simple. Anybody who tells you that this is pretty straightforward doesn't understand the science. This is huge. This is really big. This is really difficult as well to overcome. And so I think it's important for us to recognize that in this journey. This is about finding root cause. And one of the parts of the root cause is definitely the microbiome. So, yes, if you can stay with me, this is a marathon. Normally, I do these as a full webinar offline, but I need to get it for people relatively soon. So, I've put it together. And if you happen to be live with me, you'll see the full thing. Otherwise, you'll have to look in the links in the description. So let's get started with this and try and see if we can take this through. And this is one of those times where I may be able to take some questions, as long as they're good questions and I can see them in between each section. I'm happy to look at some questions and try and give some general answers to them. So let's get started on this marathon here. So, root cause one, the gut immune response to COVID. This is what I'll be covering, and this is easily about 40 to 50 slides of information. Lots of information, lots of science, and hopefully lots of stories in the process. Important to state the disclaimer, this is not medical advice. I am giving you information, but if you are sick, please go to your doctor. Get emergency assistance if it is appropriate. As I said before, this is about a roadmap. The roadmap is different for each person. Critically, the review to try and figure out where you are is the most important thing. And as you see the whole presentation, you will see protocols in there, but each one is a general rule that you have to take in order to try and get to the solution. So review, optimize, observe, and target. One of the most challenging things with patients these days is that they want a quick answer. They were well before and they want to get back to being well. I don't have a miracle. This takes a while, and for most people, this is months of work. And so, when I look at this, I am looking at a period of time, 6 months to a year, to try and get to the understanding. The advantage is that because of my focus on the science, even when I stumble into difficult things, I am likely to find ways around it. It's the exploration and the journey that is very, very important. So, the road to health is paved with good intestines. This is by Sherry A. Rogers. Very, very true and very important. This is an image of a normal intestine. And essentially, this here, the esophagus, which is after you swallow, it goes down the esophagus into the stomach. It's where it's churned around with lots of acid. So it's very acidic in the stomach, really to break down proteins. And then bits of the contents, the liquid contents, are then pumped into the small intestine, where it's then made into an alkaline environment. So lots of fluid coming in to make it in from acidic to alkaline. And a lot of the absorption of small molecules is in this part. And the small intestine is about 22 feet long, and it then connects to the large intestine. And this is where your appendix would be on the right hand side in your abdomen. This is a cut section through the walls of the colon. And so this is where more of the water is absorbed. And so gradually it goes from being liquid to being more solid. And critically, you must know that when you pass stool, this is usually the distal part. So this is the descending colon and the sigmoid colon. You can't see the sigmoid. It's usually quite a bit of an S, then out through the rectum. And this colon is about 5 feet long. And one of the big issues is that people don't recognize just how important this colon is. It's really, really important. And I can tell you from many interactions with patients that they oftentimes don't know that there's an issue there. I just had the advantage that for many people who are having chronic issues, they oftentimes have had imaging, x rays, CT scans, and then I can see problems. And I'll show you a bit later on some of the issues that come up with regards to the colon. And so it's a really critical thing to make sure that this machine, which is the intestine, is working optimally. And I usually say for a vast majority of conditions, including things like Parkinson's, which is a neurological disease, it starts in the gut. And so you have to address gut issues, especially with regards to neurology. I usually say the gut brain connection is so critical. An interesting thing that a lot of people don't know is that your gut feeds your brain and your brain feeds your gut. Really interesting. I'll explain it just in a second. Just think about it. This is the intestine, and the intestine feeds the brain by absorbing glucose. And all of these intestinal cells, what's very interesting is that they don't primarily use glucose for energy. Now, how remarkable is that? They are absorbing glucose but don't use it. It's almost as if they're passing it on to the rest of the body. So the glucose then goes to the brain where it's used, most of the glucose is used. Then the brain converts the glucose and it has used it because it breaks it down and then it needs to get rid of amino acids or nitrogen ammonia. It then produces an amino acid called glutamine, and that glutamine is then exported from the brain. That's what your gut tends to feed on, glutamine instead of glucose. And then it gets fed by the bacteria in the gut. But it's fascinating. So the gut feeds the brain, and then the waste product of the brain feeds the gut. It's a beautiful synergy. And so, one of the lessons I explain to patients is that if you don't treat your gut well, you're likely to end up with brain issues. It is one connected to the other, a beautiful synergy there. And inside the lining of the intestine, you have these villi. These are like these microvilli, these little finger points sticking up. And it's just to increase the surface area of the intestine so that it absorbs more stuff. In diseases like, say, celiac disease, these villi get flattened, and so it doesn't absorb very well. And this is really important. One of the interesting things is the amount of people who are having issues with gluten, and there's a reason for that. I can't go into it now, but there is a reason why this is rising so significantly. And it is causing lots of immune damage in the gut. And people need to be aware of it. And a simple thing I usually say with regards to gluten, this is just an aside, but I usually say to patients when they say, well, I don't think I have a gluten problem, I ask them, can you eat pizza or white bread? And if they go, woof, I can't take it, it just immediate, then I know there's a quite a good chance that they're gluten intolerant. And I clarify that that doesn't mean they have celiac disease, because that's when they have blood tests and so on. And very often, a lot of patients will come and say, the doctor tested for celiac disease and I don't have it. And I said, well, kind of just learn to observe, because if you are getting problems when you're eating white bread or pizza, it has very high contents of gluten. It may be more of an intolerance than an allergy, which is more like celiac disease. So it's important for people to be aware, because that's the kind of thing that predisposes to issues around COVID. Now, when it comes to the cells in the intestine, you have a lot of different kinds of cells. But most importantly, the most common cell is these absorptive enterocytes. And this is where all the absorption is occurring, the glucose, the fats, and everything. Then you have goblet cells, which produce mucus. They have endocrine cells there, which a lot of serotonin and so on is produced from these cells. They have cup cells, which are to do with immunity, as well as M cells, Paneth cells. They produce bacterial defensive, like prophorins and so on, which defend the cells against bacteria. And so it's a very sophisticated system. But the most common thing is these enterocytes that make up the bulk of the absorption in the gut. And they are really what we need in order to make sure that we are well nourished. And here is an image of a normal, healthy intestine. And you can see the lining here. So it's a very thin lining of epithelial cells. This would be the Paneth cells down in the crypts down here. Then this green represents the mucus on top. And then you have bacteria about that. Then you have IgAs. These are producing these defensins and prophorins to protect the immune system. And then under the surface, other than the blood vessels, you have this very sophisticated immune system. And we call all these little aggregations Peyer's patches. They're like little lymph nodes all through the intestine. And their job is to protect against any problems in the intestines over time. Very sophisticated system, and something that the body needs in order to keep everything in balance, because without proper nutrition you can't survive, and the body needs to have that balance in place. And this is again that what it looks like with the mucus layers. So if you imagine all the food is in here, then you have this bacteria in the outer mucus layer, and this is composed of good and bad. I shouldn't say bad bacteria. When they're in balance, there are none that are bad. It's just when there's some dangerous ones where if they overgrow, they can cause problems. And then you have this inner mucus layer with all these antimicrobial proteins. So the body knows to protect the bacteria and keep them at a distance, but it needs them to produce some vitamins, some specific energy, butyrate, which feeds the epithelial cell. So there's a beautiful symbiotic relationship between the microbiome and the health of these cells, and therefore the health of the body. So you have this really fascinating balance between the two. And this is why the microbiome is so critical. And anything that alters it is going to put your whole body at risk. Now, all of that is set up to prepare you for the important piece of the puzzle, which is why is this now so important in the context of COVID? Now, just to take to the basics again, when you have an infection, virus spreads, it floats in the air, and then binds to the cells in the upper airway here, then starts to replicate and spread further. But part of the process is, can it break through the wall of defense? That's the IgA and the defense mechanism in the lining of the upper airway mucosa and down in the lungs. If the virus breaks through this defense, it then triggers a systemic response. Now, what you have to know is that once the virus breaks through this defense, this is where it then has the opportunity to spread. And where it goes is dependent primarily on where you have ACE2 receptors. So remember, ACE2 is the lock and the spike protein is the key. So any cell that has ACE2 on it is going to be more easily infected and replicate again. Now, it's not just ACE2 that this virus uses. It uses multiple entry receptors. Actually, most viruses have one or two entry receptors. This one, goodness gracious, has at least three main ones and about 10, 10 extra ones that it can use to help. It's remarkable. And so this is what it would therefore look like. Once the virus breaks through the mucosal barrier, it can head to the brain, it can head to the heart. The lungs, it will spread from the airways, it can go to the liver and the spleen. But here is the biggie, the intestine. It not needs, it goes to the intestines as to one of the first and most significant parts of the body. Now, it's important to note that if you remember in the Delta wave, a lot of people had intestinal symptoms, nausea, vomiting, diarrhea. And that's because the Delta virus was having far more inflammation in the gut. But every single one of the variants goes to the gut as well, just with different degrees of penetration and infectiveness. But the intestine, because of the fact, and this is now where it is very important, because of the fact that the intestine, and I just put multiple cell membranes, this is a cell membrane, and different, what do you call it again, different receptors. There's ACE, there's DPP4, and this one here represents ACE2. ACE2 is critical in the intestine because, and you can see here, it binds to the virus, but it's critical in the intestine. I'll come back to that. Critical to the intestine because it binds or it works with a transporter to take in tryptophan from the intestine. And so, because the ACE2 is there and it's not really working in the same way in the renin-angiotensin system, it's in this sense working as what we call a collectrin. So, it's helping the transporter to function efficiently, but it can still be used as an entry point for the virus. And so, when you look at the spread of the virus, it then has a significant impact on the intestine. And this is where now that inflammation, this is kind of more to do with the long COVID picture, but the principle is that the intestine downregulates the absorption of tryptophan, which therefore reduces carnitine, which therefore reduces ATP, and people get fatigued. But it's just to show you that huge cycle, which I'll come back to later, about what happens in terms of inflammation in the intestine and why it's critical. When you actually look at the intestinal inflammation as well, this is what it would probably look like, where you have lots of virus going into the small intestine and the colon, causing inflammation. And this is the look inside of, this is more small bowel. No, this is actually large bowel, where you will see this red, this is hyperemia. No, this is not a SARS-CoV-2 infection. It's just showing you what inflammation inside the intestines can look like. And you can see this redness. That means that it's inflamed. And that's what it could probably look like if somebody was to do one of these scopes at the time when somebody had infection with SARS-CoV-2. So this is why the intestines is important, because the virus takes that as one of the critical locations to be able to enter into. So you have to therefore remember the road to good health is paved with good intestines. And that is especially true in the context of the pandemic. Alteration of the gut microbiome through infection and vaccination is probably the biggest health challenge of the pandemic. And sadly, it's the most invisible. Very few people will know what in the world has gone on. And depending on their resilience, they won't even feel unwell. A lot of times, this has an impact down the road. Now, what we don't know is exactly what the mechanism is. All we know is that something, we don't know if it's the mRNA, we don't know if it's the spike protein, we don't know if it's a whole virus. All we know is that these bacteria that are impacted by this start producing a whole bunch of toxins. And these toxins then kill other bacteria and cause other kinds of inflammation in the body, in the host. And this is the biggie. So when I talk about this is me going down the conspiracy line for a moment, but this was just so well designed. I struggle to believe that this could be random. It is just so incredibly powerful what is happening here. So guess what then happens? So the bacteria that are able to take up whatever it is, the spike protein, the mRNA, this virus, we don't know, they then start to produce different bacterial toxins on top of what they did, because bacteria tend to hold their ground with their toxins. These bacteria start producing a whole bunch of toxins and then start to destroy the other bacteria around. This is a critical part of the problem. Now, when we looked at what occurred, and this was a paper from 2021 when they were looking at fecal samples, and so this is really just a summary of it. And they took samples of people's stool at different time points. So you can see here, day 0 is kind of white, day 1 light blue, day 7 a bit more blue, then day 14, then 21 dark blue is day 30. And then they looked at the different categories. So you have Clostridium, E. coli, Helicobacter, Pseudomonas, Bacteroides, Lactobacillus, Bifidobacteria. And what they noticed, therefore, was Clostridia was at 4 at the beginning, By 30, it was at 7. This is almost double the amount of Clostridia. The E. coli went up and then came back down by day 30. Pseudomonas went up and came back down. Similarly, Bacteroides went up and came back down to a bit lower. But the bit that is really, really important is what happens to bifidobacteria. This was literally completely wiped out. Similar, Rhodococcus. These two groups were completely wiped out by day 30 and replaced by Clostridia. Now, the implications of that are so significant because those bacteria that were wiped out are some of your very important good bacteria. Your body needs them to keep the bad bacteria in check and also to help in the digestion of some of the stuff that you're eating. And so, if you don't have them, your gut then has depletion of energy because it doesn't have the resources that it needs. Now, this same paper did something very interesting in that they did antibiotics on the different fecal samples, and they did pre antibiotics, post antibiotics, looking at viral load. So they were looking at what happens with viral load. Just let me explain this carefully. They found that when they put somebody's stool who had been infected in stool of somebody who had not been infected, the viral load increased over about 30 days. Don't know the mechanism. All we know is that it seems to be done by bacteria. So, because of that question, this is then what they did. So, then they cultured the same stool that had the viral RNA with with different antibiotics. So, you can see here metronidazole, clindamycin, lincomycin, amoxicillin, vancomycin, ampicillin. So, they did 16 different antibiotics. They looked at the viral load pre antibiotics and post antibiotics. And what you found is, say, with clindamycin, not much difference, slight increase with lincomycin, but completely wiped out with metronidazole, completely wiped out with vancomycin and amoxicillin, completely wiped out with azithromycin. Most of the other antibiotics, some of them, ciproflox, did a reduction but didn't wipe it out. And so you can see different responses, but 4 antibiotics completely wiped it out. When I looked and did the correlation, it almost certainly pointed to Clostridia. So it seems that Clostridia species, the one that overgrows, is somehow not only making bacterial toxins, but replicating the RNA for the virus. This is just a nightmare kind of scenario that we could have ever seen. In effect, it's turning our microbiome, instead of it being symbiotic, to being pathogenic. Incredible, but we have got to find a way to fix that. And this is part of the reason why I am saying this cannot be done with just a pill. You need a whole protocol, a whole approach, a whole change to the lifestyle. This is not for the ones who are just looking for simple answers. I can't help you there because this is a complex problem. And so this is where we then have these bacteria producing toxins. They're wiping out the good bacteria. They are overgrowing. And then they are producing more toxins, which are making the body sick. This, as I said, is an absolute nightmare. There's a word, I won't use it because I'm recording it, but it's some kind of it show. This is just disastrous if this is occurring across the population. And as I said, many people are completely unaware about this. And so we see this rise in Clostridium difficile. This is my expectation with toxin. This is what is happening. We're going to see more streptococcus infections with toxins and the gut bacterial overgrowth with worsening gut symptoms. And this will gradually occur throughout the population over time. Really, really important to protect your gut to make sure that you are in the best of health. So, this is my quote: alteration of the gut microbiome through infection or vaccination is the biggest health challenge of the pandemic. Right. Okay. Coming close to the end of this marathon. So glad that you're still with me. So quite a lot of people are sitting through this. This is actually very important information, and I think that it is critical. Somebody mentioned in the discussion there about biofilms. Biofilms are where bacteria almost build an apartment complex, and it's hard to get at them because it's like building the apartment complex with rooms on the ground, and so it's difficult for the immune system to get at them. And these biofilms now are having, once they were already in place and they grow more, this is part of the problem with regards to what's happening, this growth of these biofilms. And it's not just in the gut, but it's also in the upper airway, in the sinuses, in the epipharynx. But that's a whole different, that's like root two, a root cause two, another aspect of the presentation. All right, let's get on. Right, that's the presentation done. So thank you all the people who have been with me. This has been very good. And remember, as we try and close out now, I'll take you back through the thing in the description. Well, first thing, just make sure you've liked and subscribed. The second thing is that you click on the link, you will get a root program webinar application. This is for people who want to try and overcome the health challenges. There are limited spaces available, so we do select who will be able to join in. And what you will find is that I'll show you here is when you then go in, you will then find that this is what you have: your name, your email address, your primary health concern, how long have you been having it for, how motivated you are you really willing to invest in this, and general other information. Keep it very simple and general. I don't want your detailed health information. This is just a guidance. So for all the people who want to get involved, this is a process, and this is something that I'll be doing over time because I know so many people need it. This is a big part of trying to protect the population from what has been done. Turning our gut microbiomes against us is probably one of the worst outcomes that could have happened. So, thank you very much. Let's work on ways to resolve the health issues in the future.